Another edition of Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Good morning, all those out there listening.
We got a lot to cover here today. We're going to start with thermography.
Yeah, absolutely. Again, blessed with the Acacia Wellness folks. Kelly comes up, her amazing team out of Lincoln, and they offer an amazing resource, in my opinion. Everybody is looking for options in today's day and age with regard to wellness and surveillance. And thermography, for those that aren't aware, it's an infrared camera that can take a peek not only at breast tissue but the entire body. And it looks for areas of inflammation, and inflammation can be seen on this camera, and it measures warmth in the form of that inflammation. The FDA and the American Cancer Society, a lot of these places are still saying the gold standard for breast cancer surveillance is mammograms. But some women are out there and saying, well, I don't really want to go that route. So one of the many things during COVID, I'm a very big believer in informed choice, informed consent, and folks should know their options out there to them. And thermography is an option that doesn't provide radiation. Mammogram squeezes that breast tissue and can do a little bit of a low-dose radiation, and that has some women a little bit hesitant to go that route. So again, informed choice, do your research, and they do a great job. They've been coming up to the Okoboji Wellness Clinic over the course of the last 6 to 9 months. I know our guests and patients have spoken highly of their work, and so they're coming up again April 27th through 29th, 3 days, and to schedule with them, 402-403-1910, and we do have a few openings left. They're limited. Every time they come here, they are full. There is an absolute interest out there, and it's a great opportunity in rural location to be able to go in and do those sorts of things. Again, she does ultrasound as well, so she can do ultrasound of the breasts or other areas of the body. Many folks will even do a whole body thermography, not just looking at the breast, looking at other areas of inflammation that can provide a clinical picture to help guide a path forward. Working with me, for instance, or other members of our team, we can look at that imaging, and that can help guide some of our recommendations as well. So again, April 27th through 29th, 402-403-1910 here at the Okoboji Wellness Clinic over those 3 days, Acacia Wellness. So please take advantage of that. It's pretty cool, again, to be in a rural setting and offer such amazing opportunities and options to get on that healing journey and to learn more about our body systems.
We've talked about this before, actually, where sometimes you might be maybe conflicted by a diagnosis because maybe your primary care provider or the person you're seeing isn't 100% sure of the diagnosis, and they're thinking about maybe doing exploratory surgery. This might be a good way to get a second opinion. Maybe it's infection that you have, or maybe it's some other reason that you're inflamed, and because your inflammation is so much, they can't really perfectly detect whether something is cancerous or not.
Absolutely. So again, we like options, and the more different tools that we can look at what is the clinical picture in front of us, that's a good thing. And this is a nice non-invasive way. That's why men and women, both men, do the whole body thermography as well. But why it's so popular, one of the many reasons, again, there's no radiation with it, and you just stand a couple of feet away, 3-4 feet away from the camera, and that's all there is to it. She has you in a gown, and so it's pretty easy from a patient perspective getting the procedure done, and the information you gather from it also is quite revealing and can be quite helpful.
All right, so April 27th through the 29th, very few appointment slots left, 402-403-1910. 1910. Let's move on. Mental health. You've had a big success story.
Anxiety, depression, we're always, believe it or not, and for those that have suffered from anxiety or depression at points in life, they can understand this. That by itself can impact your health in a big way. And we're always looking at health teeter-totter. What are the things that are stressing the body? And whether that's some kind of toxin, some type of food that we're eating, maybe mold, maybe some kind of allergy in the environment. But sometimes it's the stress itself. It's a life stress, a job stress, a family situation. And that can impact one's immune system in such a big way that eventually folks physically can get sick with it as well. But the anxiety and depression piece, what I love when folks come through the clinic here and we get to work with them on a multitude of different areas, and sometimes different treatments or different treatment combinations really shine. And in the case of one of our recent patients, guests, they had suffered from debilitating anxiety and depression for years, to the point where on multiple prescriptions and such, and in limiting ability to be active in the community and hold a job because that was so crippling for them. And so we got started with one individual in about 6 weeks ago, thereabouts. And the results that we've seen with the combination treatment that they've underwent has been absolutely inspiring. And you kind of get going on the process and lay out a path for individuals. And God always, as I work in this integrative space, Dave, this is the integrative medical space where we combine holistic and the traditional and try to find the best of both worlds that are going to benefit the patient to feel their best and to thrive, not just survive. I'm always excited when there's new members of the team that to outside of our walls to collaborate with. And we have an individual that's a MD psychiatrist in Sioux Falls that's an integrative psychiatrist. So, in fact, this individual has really worked a lot on gut and digestion and seen some incredible results from a mental health perspective in a way that's touched their own personal lives with family. And so they've become more open to different approaches as well, but they also know how to handle different prescriptions and eventually, hopefully, in combination working with us and this integrative physician, some of these heavy hitter psychiatric meds we may be able to wean off of over time. But the secret sauce with this gentleman was just he did IASIS Neurofeedback. This is a way to kind of reset the fight or flight response, and we've had it for about a year now, and it really seems to impact mental health in a really positive way. It's a 15-minute treatment, typically twice a week, and he shared that after that first treatment that he noticed almost an immediate impact in his anxiety and stress. So he's been working with that. He's been working with Hyperbaric, which also has an incredible track record with mental health, anxiety. That really has a way in calming the whole system down as well. You know, over 19,000 anti-inflammatory genes are turned on with one hyperbaric treatment, and it really helps with that parasympathetic-sympathetic balance, which can get out of balance in moments of stress and can stay there. So that combination, and then he's done some work with Molly on nutrition, and he's really cleaned up a lot of what he's eating. And he's worked with Mychal Sheridan, who does reflexive brain work. And the combination, it's just been, he gave a 70% improvement in a matter of 6 weeks, and he's like, he had shared that he hadn't felt this good in many years.
Wow.
And so it's such a cool, and so I think, okay, anybody that's out there that's suffering from feeling like they're spinning their wheels on or with the stress and the mental health, a variety of anxiety, depression, and beyond, this may be a good approach for you. And I come on in and we would sit down, maybe do a discovery call, which is complimentary. You just call 712-339-6024, and you can do that with either Molly, Mychal, or myself, and we can talk about a potential path forward and to get you in for a full hour visit and get you started, because you owe it to yourself, you owe it to your family. Who doesn't want to feel their best? Most of us do. And we just can get in this spot of stuck and not sure how to get out of it. And in the case of anxiety, we have some tools that in mental health and depression that can be highly impactful. And again, like I said, growing the team, having folks that know a multitude of tools, including some of the traditional tools for anxiety and depression. What a gift that is to have that option, because a lot of folks sometimes they're like, well, I'm not sure they're gonna, if I go see the specialist, I'm not sure they're gonna understand that what I'm working with here on the holistic side. In the case of this physician that we're working with, they do.
Yeah,
so.
Very cool. Listen, I could be visiting with you all day today. There are so many topics in the news that I'm running across, but we're going to have to save some. But I want to squeeze this one in real quick. Mitochondria, you're one of the first people that I know of that brought up mitochondria in a big way. We've seen where incandescent light bulb is better for your mitochondria than LED. Now I run across a thing where if you have your cell phone close to you during the night, it's a mitochondria wrecker. You got to move your cell phone away or put it in the airplane mode so it doesn't affect your mitochondria through the night. How crazy is that? We have things all around us, from light bulbs to our cell phones, that are affecting our mitochondria. And you were one of the first up talking about mitochondria health and how it drives our overall health.
It's huge. It's at the crux of metabolism, of disease and wellness, and absolutely switch that onto the airplane mode and think of it as a drain to the battery. The mitochondria is your battery, and a lot of us, we lose the charge of that battery as we get older due to a multitude of reasons, and one of them can be Wi-Fi and LED lights, and if we can do these things. And then the other thing, the mitochondrial booster, I didn't even mention this for the mental health and anxiety perspective, that is a mitochondrial booster, red light therapy, and that is a form of, in many cases for many people, a form of, which is part of the whole visible spectrum and non-visible spectrum from the sun, is also highly impactful. So it's pretty interesting. There's some frequencies that are not so good for us in the form of Wi-Fi, and there can be some frequencies of light that actually stimulate that mitochondria and make it happier. We want to be able to help determine which ones are which and then help mitigate that risk. And one of those ways, Dave, you're absolutely right. Something as simple as, oh, man, am I scrolling on my phone before I go to bed at night and it's sitting right next to my head all night long? That can't be good. So let's not do that. Let's turn that into the airplane mode.
There you go. All right, we got to go. Thrive, not just survive. Don't just make it through the day. Feel the best you can. Dr. Meyer, again, how can folks come see you or set up phone consult with you? How do they do that?
Yes, we're at 3305 Berkwist Avenue in Spirit Lake off Highway 71, just next to Ace Hardware. And we are here to do that initial visit, which is typically an hour long, or that free discovery call if you have further questions before that first visit. But 712-339-6024. Let's get started.
Very good. Dr. Meyer, thank you so much. Have a great day. We'll chat again soon.
Thanks, Dave. Be well.
Thank you. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more online as well. OkobojiWellnessClinic.com.